Hi, it's Christina with the Sisyphean Journal. I want you to imagine for a minute that there was just a horrible drunk driving accident in your city. That, a drunk driver swerved into the other lane and killed 3 people. Would you expect the newspaper to be quoting people, pointing out how safe driving is and that there are only 1.34 deaths per 100 million miles driven? Or would you expect them to focus on the irresponsibility of driving drunk? I would guess that if you're like most normal humans, you would expect them to focus on, doesn't matter if overall, 1.34 people die per 100 million miles driven. What matters is that drunk driver just killed 3 people. But that's not the way that the news responds when there's an abortion death. Then they just have to tell you abortion is ever so safe. And that's what they did after the 1979 death of 21-year-old Geneva Colton. Now, Geneva was trying to make a better life for herself and her 2 children in the summer of 1979. She was working 2 jobs, full-time as a meter maid and school crossing guard for the Cochrane Police Department and part-time at a restaurant. So when she discovered she was pregnant, again, she spoke to some friends, she spoke to a doctor, and I'm going to quote what one of her friends said to the Atlanta Journal-Constitution. She was a unique individual in that she was a young black woman with 2 children who could have had a relatively carefree life on welfare, but she elected to fight it, and she was pulling herself up by herself with no hope really from anybody much except the friends around her who loved her. And this friend, Joy Fisher, noted that Geneva had almost completed her GED, which was a vital step toward achieving her dream of becoming a police officer. So after speaking to her friends, after speaking to a doctor, Geneva decided that she would go for an abortion at Northside Family Planning in Atlanta. And Joy wanted to be a supportive friend, so she offered to help pay for the abortion, and she drove Geneva to Atlanta. And Joy said that Geneva was in good spirits as they were driving up, talking about her 2 young sons, and evidently thinking that she was going to get rid of this problem that was getting in the way of providing a brighter future for them. So it's hard to say what time the abortion actually started, because the news coverage only notes that Geneva and Joy arrived 10 minutes late for her 9 o'clock appointment and that the clinic was pretty much packed. They do say that it was 4 p.m. until the 2 young women started to drive home. She was obviously in pain coming back, Joy told the Atlanta Constitution. I stopped once to buy a pillow to make her more comfortable. She appeared to be having abdominal cramping, which they told her she would experience. It was about 7:30 that evening when Joy dropped Geneva off at a friend's house to convalesce. About an hour later, she got a call that Geneva had been taken to the emergency room at Bleckley County Hospital. Geneva had no vital signs on admission, and doctors were unable to revive her. They pronounced her dead, and the autopsy found that Geneva's uterus had been perforated and she had bled to death. Now, to their credit, Northside did report Geneva's death to the Centers for Disease Control, and epidemiologist George Rubin did admit to the Atlanta Constitution that the 5 deaths there had been in Georgia up to that point after the Roe decision did constitute a rash of abortion deaths. But he quickly went into damage control mode. Hey, abortion's ever so safe. I don't know about any state investigation. At the time, my understanding is that the state really couldn't do anything but make sure that the clinic had a doctor on staff and a business license. But Northside was sued by their insurance provider because they'd allowed one of their doctors to continue to perform surgery even though his manual dexterity had deteriorated due to multiple sclerosis. And the insurance provider also cited failure to meet state health standards, failure to have enough nurses on duty, failure to have on-call procedures, and lack of a professional director of medical services. Now, to their credit, 2 Democrat politicians did step forward and say maybe we should do something. A Georgia House subcommittee looked into conditions in Georgia abortion facilities, which again weren't regulated at the time. Representative Billy McKinney an Atlanta Democrat, told the Atlanta Constitution after touring the facilities, "I had a concern last week that maybe there ought to be a holding period to see if there are any complications. I wouldn't consider such a regulation too stringent. Maybe we have to look at how much time the patient should be under care and not treat it like an abortion mill. I was concerned to learn that they keep them about an hour." So, I mean, this is clear back in 1979, and even a pro-choice Democrat is saying maybe you shouldn't just chuck them out the door. But I've said it before, because abortion clinics consider the fetus the identified problem, you know, they weren't going to look holistically at Geneva's life. They weren't going to look at, okay, how can we help you finish your GED and move into training to become a police officer while parenting 3 children rather than just 2 children. You know, her struggles weren't the problem. The fetus was. You get rid of it, Geneva's no longer your problem. And I've talked about the fact that, you know, that focus on the fetus, we get rid of it and then shove the woman out the door and don't worry about her anymore, is why a lot of these abortion deaths take place. You know, McKinney stressed that the committee wasn't trying to have any impact on the decision whether or not to proceed with an abortion, but merely to ensure that, quote, "the facility in which the abortion is performed is safe enough to protect the woman's life." And another Democrat, Representative Betty Clark from DeKalb, agreed, "It makes a lot of sense to me. There should be some period of time for observation." So those two really stand out. Pro-choice Democrats actually wanting the abortion to be performed safely rather than merely performed. I also think that Atlanta North Side might not have necessarily fixed things too much because it seems to be the same facility where Catherine Pierce suffered a fatal abortion in 1989. When Catherine went there, the clinic was called Atlanta Surgery Center, but it had previously done business as Northside Women's Clinic. So they change names a lot when they get sued to kind of get rid of their assets, so I've been unable to verify that. Keep coming back. Every year I look into each situation a little bit more. Then we get into the racial question. So as a black woman, Geneva was nearly 4 times more likely than a white woman to end up on the abortion table in the first place. And once she enters that abortion clinic, her risk of death is still higher than the risk of death for a white woman. And to my knowledge, why that is the case has never adequately been explored. And in the wake of the Dobbs decision, the abortion lobby and all of their lapdogs are screaming that this is going to cause more black women to die because maternal mortality among black women is higher than among white women. Well, that includes abortion mortality, and that never seemed to bother them, that black women are more likely to die from abortion complications. In fact, if we look at just the abortion deaths that I personally have found out about at Planned Parenthood, the nation's flagship abortion provider, half of those deaths, the most recent ones more pointedly, were of black women. And if you follow the link below to the blog post about Genevas Death, you'll see that I do provide links to those women's stories. 2016, Cree Irwin Shepherd, black. 2012, Tanya Reeves, black. 2009, Roselle Owens, black. 2007, Edrika Good, black. Then 2003, Holly Patterson was white. Vivian Tran in 2003, Asian. Diana Lopez in 2002, Hispanic. And Elise Calat in 1987, white. Now please note that probably more women than this have died from abortion complications after they went to Planned Parenthood. These are just the 8 that I have been able to find information about. And, you know, if you look at the chart I provide, you see it's a little bit odd how disproportionately their dead patients are black women. Now, Genevas Death was one of a cluster of deaths in the Atlanta area. Teenagers Angela Scott and Dolores Smith had been fatally injured within an hour of each other on June 2nd of 1979. Now, at the time Geneva died, Dolores was still in a coma. She had not died yet. But like I said in my intro, news coverage of this cluster of deaths tend to mention the low abortion mortality rates claimed by the CDC instead of saying something funky's going on here that we need to look at. And as for the Feminist Women's Health Center issued a statement. The first issue is that a legal abortion is safe. Out of the 150,000 abortions performed since the 1973 Supreme Court decision legalizing abortions, this is the first death to occur in Atlanta related to the abortion procedure itself. I would think that the first issue would be the dead woman, but that's not how the abortion lobby looks at it. They shrug off Geneva's death. They dismissed Angela's death as not related to the abortion procedure itself, and didn't even take a glance at the comatose Dolores Smith. They just fall back on, if it's legal, it's safe. Don't worry your pretty little head. Now, you all know I'm disgusted with the abortion lobby, except for those two very brave pro-choice politicians who did try to step in and make sure that it wasn't just about the fetus dying, it was also about the woman surviving.